Thank you very much, Acting Deputy President. I too rise to speak on the National Health Amendment Technical Changes to Averaging Price Disclosure Threshold and Other Matters Bill 2024. And as the Shadow Minister has made clear, the Coalition does support this bill, but we do raise a number of concerns. And of course, as we know, the bill before us today clarifies the operation of the Act, which relates to designated brands subject to the price disclosure thresholds. So the bill includes only technical amendments which are intended for the avoidance of doubt and do not alter the operation of the existing provisions which have been in effect since the 1st of July 2022. The introduction of the 2024 bill follows recent federal court action by a generic medicine company. And while the federal court dismissed the case, this amendment addresses the potential risk that the timing of a price disclosure reduction could be invalid. So, as I say, the Coalition will support this bill because it clarifies the provisions of the 2021 Amendment Act, which was brought in under the former Coalition government and forms part of the important strategic agreements we made with the pharmaceutical industry. But I don't want there to be any misunderstanding by the Senate that in supporting this bill, we do not support so much of what has happened in the health space for Australians under this government, because Australians know, Acting Deputy President, that Australia's healthcare system faces very significant pressures at every point. Our hospitals are overrun. Ambulance ramping is at record highs in states across the country. Primary care is at a crisis point, with Australians facing record challenges in getting access to affordable GP appointments. The Albanese Labor government has failed Australians over the last 2 years as the cost of going to a doctor has skyrocketed and bulk billing has plummeted by 11%. In fact, it has literally never been harder or more expensive to see a doctor, and that's even more so in regional Australia, in remote parts of this country. Data from the Australian Institute of Health and Wellness shows that Medicare is covering the lowest percentage of GP fees on record. That's the lowest percentage on record. That means that Australians are paying the highest amount of out-of-pocket costs. And when you consider the enormous cost of living strains that so many Australians are under right now, the cost of electricity, power, fuel, groceries, the dread of walking to the mailbox and opening up the mail to see another bill, Australians do not need to deal with the increased costs of going to the doctor. So the cost for patients has risen to the highest level on record. This is having really serious consequences, as Australians are having to make the difficult choice of going to the GP or paying their bills in the middle of this cost of living crisis. That is why last financial year we saw 2.4 million less GP services provided to Australians. Workforce shortages are also impacting almost every area of the system, whilst the government refuses to take action. So there needs to be real and urgent action to ensure that all Australian patients have access to the care they need, when they need it and where they need it. And so, as I say, while we support this bill, we remain deeply concerned about the way that Australians are being let down when it comes to getting critical health care they need under the Albanese government. Thank you.